Someone mentioned kind of self-interest, and what I'm, aware of is that each organisation attached to any integration or partnership will have their own self-interest, which will be kind of in terms of the duty of care to staff. And I just wondered, has there been any kind of positive examples of kind of models of employment that the partnerships have entered into, in terms of what does it look like, in terms of, is there a lead employer, is there memorandums of understanding in terms of, when it comes down to it, who employs the staff, what terms and conditions are they under? Because I think it becomes a bit complicated when there's different policies people are come under, different management arrangements. So it's quite a tricky thing to navigate.
Lead employer. Okay, who would like to pick that one up? John?
So a really critical question, an important question, but one that we've sort of put to one side for the minute, because one of the difficulties that we would have had, I think, would have been very, very complex in terms of trying to achieve that. So what we've done is built on our existing processes, which is through the Section 75 agreement and secondments. Now, because we've had those agreements with NELFT for a long time, our working relationship between the two HR departments is very strong. And that comes back to this experience and this working together. So we've transferred people currently at the moment under secondment, and what we've done is looked at how we can actually delegate some of our what we call standing orders within the local authority to the health colleagues. So the director who's responsible within NELFT will have the responsibility and the standing orders transferred to enable him to manage through the systems. But you're absolutely right, it's that bridge too far. And I think what we wanted to do was build on our experience already, make sure that we could actually make sure the system works, and then address it at a later stage. One thing we have done, though, of course, within local authority is we're used to now working in different ways because of public health. So we've had to broaden out our experiences in terms of that, and that's really helped. Another thing that's helped is the fact that our HR business partner that's been supporting me throughout all of this previously worked for NELFT. So she's got an understanding of the HR systems in NELFT, therefore got the trust and confidence of NELFT, and so on and so forth. So I think, yes, it's an ideal to move towards, but actually the benefits for us has been about the experience, the trust, and actually being able to know that we can do that successfully in that model at the moment.
Thank you, John. Next question. Lady at the front here, David.
Thanks, David. Hi, Amanda Price at Guy's and St Thomas's. Quite a few of you mentioned leadership at all levels, and the need for both the business skills, assertiveness, commercial skills, and also more of the people side around engagement, empowerment, enabling. How do you think we can both find people with that broad range of skills and enable people to develop those skills once they're working with us?
Who'd like to pick that one up then? Patricia?
So, is this one on? Can you hear me? Yeah. So I think we have to start by bringing in some people from the commercial sector who help us look at the way we work in a slightly different way. So I think staff on the front line lack financial skills. They lack skills on how to manage their budgets effectively, the ability to be able to look at the skill mix in their team and think about what would they do differently, what does that mean in terms of the way they deliver care. So I think we're going to have to bring in some external expertise to start to build that. I think then what we've got to do is we've got to give staff on the front line the opportunity to apply those skills. So we've got someone working with us at the moment who's come in to give us a more commercial view. And what he's doing is working with the teams on the various contracts and on the redesign of their services and making them look at, if this was money in your pocket, what would you do with it? How would you manage the way you deliver what you're doing? What does 30% look like? And the term I use a lot in the organisation is that we have to have discussions with our commissioners about if they think they're getting a cake with icing and a cherry, actually, can they afford a cake with icing and a cherry? And maybe they can't even afford a cake, so what could we give them instead? I think it's, we need to bring in some skills. We need to give staff the opportunity to go and develop those skills. But actually, on the front line, I think we need to let them practice it. I think that's what we tend not to do. We get into financial difficulties and we suck all that responsibility away from staff on the front line instead of saying, actually, staff on the front line need to be told you've got 2 and 6 to play with. Go and tell us how you can do it effectively.
Very good. Next question. Somebody right at the back. Where's David? You're going to have to run. Carefully.
Thank you. My name is Reg Carpen, and I'm the HR Annuity Lead for Urgent Care Cambridgeshire. My question is a supplementary question to the last one, really. It's about, we talk about integration. What are the skills that connected with integration? Professionals are trained in unidisciplinary. We have doctors training, nurses training, all regulated and assessed along certain competencies. What I'm not sure is what are the specific skills? What are the skills, knowledge, behaviors, and attitude connected with integration itself, so that we can then have a program of development for people to develop those skills? Because we talk about new roles with new skills means new training. For example, we've got 6 pharmacists, independent prescribers, working urgent and emergency care. And at the moment, it's more to do with prescribing, giving advice on the phone.
Yeah.
But we want to move to the next stage, which is developing a treatment skill, assessment skill, so that they become an advanced practitioner.
Okay, thank you very much. That could be a very long answer. Conor, do you want to give it a go?
A short answer.
In your usual pithy style? Because we have actually covered a lot around what the skills, knowledge and attributes could be from the presentations, but anything you want to add?
I mean, the core skill is, as a team, which I think was a theme throughout all of our presentation, is we don't train people as in teams. You look at other training that happens across the globe, and they have different styles of training. Physios with OTs, with medics, with nurses, as teams to care for people. We train people around models of professions. So fundamentally, if we are going to achieve this, we can do so much locally by equipping people with different ways of behaving in teams, but ultimately it's going to require a very different national approach to professional education. Right? Just take out the professional. What is the skills, competency-based education around teams to deliver more effective health and social care outcomes? Now, that's an easy answer to make. How do we do that?
Yes.
I think, let's wait and see, but it has to happen, otherwise we're all going to end up fighting between ourselves. And we see some of that at the moment, don't we? Around 7-day working and other types of things. And that's only, in my head, going to get worse before it gets better. We're going to have to work through that disruption. So wait to see what happens next with the government.
Caroline?
Can I just very, very briefly agree with everything that Conor just said. I think, so we've looked at rolling out a workforce programme which we've called the Change Academy, and one of the bits within that is focusing on continuous improvement and how you embed continuous improvement in working, because I think we kind of talk about this holy grail of integrated care, and I think as though one day we're going to get to a point where we would say, great, we've delivered integrated care, and I don't think we ever are. I think the trick with integrated care is that the population's needs are going to continue to change, demand is going to continue to change, and what we actually need to do is develop a workforce that is able to be agile and reflective about the services it's developing, know when things need improvement, know when things aren't working, and have kind of an inbuilt process to be able to deal with that. So for us, I think thinking about that kind of continuous improvement and within a team is a really, really core competency of sort of making this fit for the future, really.
Great, thank you very much. So before we break for coffee, because we're running over slightly on time, any one last question? Burning question from anyone? Lady at the back, David, right by you. That's handy.
Hi, I'm Dawn Harvey, Birmingham Children's Hospital. And this is quite a practical question for the panel. So across Birmingham, we've got some great examples of introducing new models of care, new models of delivery, partnership working across the NHS and private sector. And one of the things that's always difficult for the workforce is when we move from the theory to the reality of the change. So even when people have been involved in designing the different models of care, when it comes down to it and personal needs are rocked and shaken, then change becomes difficult. And I'm wondering whether the panel have got any practical advice or examples of things that have worked when that change does become very difficult.
Right, that's a really, really good question. So I'd love to ask each of them, if they can, to give one very quick, practical thing that they want to share. But can we keep it quick? Thank you. John.
Yeah, so actually physically do it. So one of the key things for us is that we've just brought the NELFT management team in before Christmas that are going to be working collectively as a whole team with us. So I went away for a few weeks before Christmas, and I came back and I'd forgotten that we'd put that in the plan. But actually, as I opened the door, the whole of our workspace looked very different. And actually, the practicality of seeing that move and shift and saying you're going to do it at a set time and then doing it really does help, so that people are anxious and concerned. But now, if you walked into my space, you wouldn't know that they've only just moved in because they've actually integrated already. So there is something about the promise, and then there's something about the actual doing, and you have to make sure that those milestones are met.
Brilliant. Thank you, John. Steve?
Actually, I'm sorry. I was thinking of co-location as well, so I haven't really got anything to add to that.
That's
piece
okay.
that John's just said.
That's reinforcing that co-location is actually really important. Caroline?
I know it's really trite, but communication, and just that you just can't ever do enough of it. And even when you think you've done enough, you still won't have done. So just every channel that you've got working with people, then yeah, just communication.
Thank you. Patricia?
I think probably listen to the individual voice as much as the collective voice. So we do engagement events and so forth, and you hear what the collective themes are, but actually I think every member of staff in a change process deserves to have that time when you go, this is awful for me and it's going to affect my family and all of that sort of stuff, and let people know that they're able to do that, but there is still a process that they have to be involved in.
Thank you. Last but not least, Conor.
Well, probably least, because I think the panel has probably said everything. There's very little I would add to that, except being absolutely honest and transparent. People are scared and fearful of the future, and they're going to grieve for loss. So you need to balance that with something much more bright and positive, if that's possible, but recognise and be honest about it and be clear. It's going to be very difficult, but we're committed to minimising that and working through.
Thank you. I think we'll end it there. Thank you very much to our panel.